I'm Yoetzet Halacha Rivka Sonnenberg, and I'm here with Julie Rubinstein. Julie, can you tell us a little bit about your background?
Right, so I've been a nurse for almost 6 years. Currently, I work as a diabetes educator, doing counseling for people who have been diagnosed with diabetes.
What are some ways that diabetes affects women's sexual health?
So diabetes is a disease in which the body has trouble processing sugar, and the level of sugar in the blood becomes too high. Because of how high the sugar is in the body, it can affect women's health by causing yeast infections, causing bladder infections, causing pain with intimacy. And many women also become so overwhelmed with the burden of looking after diabetes that they become burnt out and they're not emotionally available for intimacy.
What's the connection between diabetes and yeast or bladder infections?
So when a woman, particularly if the diabetes is uncontrolled, her urine becomes very sweet, which creates a really nice environment for yeast and bladder infections. But that's really uncomfortable, as a yeast infection causes itching and it can cause clumpy white discharge. And a bladder infection can make peeing very painful. Someone will also get belly pain and a bit of a fever if they have a bladder infection.
Can that be managed?
Right. So any women's health issue with diabetes can be helped with controlling the blood sugars as much as possible with careful watching of the diet, medications, and exercise. But specifically for yeast and bladder infections, it's important for the woman to go to her doctor and explain the problem so that she can get an antibiotic or an antifungal medication if it's necessary. She can also discuss with her doctor the diabetes medications that she's taking. Because some medications, even though they're really good at lowering the sugar, can actually increase the risk of getting a yeast or bladder infection. So if a woman is having a problem with this, she and her doctor may want to put her onto a different medication that's just as effective, but is going to cause fewer problems.
Thanks. How does diabetes contribute to pain during intimacy?
So yeast and bladder infections can contribute to pain in intimacy because everything is all irritated. Once the infection is treated, pain could still remain. In some women, the high sugars of the diabetes have actually damaged the nerves so that the body is unable to produce adequate lubrication.
So that can cause some pain during intercourse. Is there a way to manage that?
Absolutely. So it's important to go to the doctor and have any infections treated. As well, if a woman has nerve damage in one part of her body, it's likely that to have nerve damage in other parts of the body as well. So she should get that checked out. In addition, she can go to the store and buy a lubricant, and she should be careful to go slowly and make sure her body is ready when she's being intimate. That will help make things more comfortable, even if there is nerve damage.
Thanks. Last question. What about diabetes burnout? What is that?
Some people, it's very burdensome to manage the diabetes. It's stressful. They're always checking their blood sugar and they're watching what they eat and they're watching their exercise and they're looking after their medications. And for many people, it's very overwhelming. And the difficulty is in some women, it becomes so overwhelming and they're so caught up in stress. Emotionally, they're not able to be intimate.
So what are some of the best ways to manage that?
So this can be come at from two different angles. The first is to go to the diabetes team, explain the burnout, and see if there's anything that can be done to make diabetes management a little bit simpler. Can the woman check her blood sugar less frequently? Is there a different medication regime that's easier to follow? Is there anything that will just make things better? The hardest part, but what's really the most effective, is she needs to find a counselor and be brave and speak about how stress is impacting her life. If it's impacting her intimate life, it's impacting other parts of her life as well. Working with a counselor, she can learn new ways of coping so that the diabetes and other parts of her life are less stressful, and she's now emotionally more available to be intimate.
All of these pieces are such subtle ways that diabetes affects the whole person, not not just in the way that we think of with diet and insulin and controlling the blood sugar.
Exactly. What I've personally found in practice is many women will suffer for months or years with problems because they don't realize they're related to the diabetes, or they're embarrassed to talk to their doctor, or they just don't think it's important enough to bring up, or that it can't be treated. But any of these problems, it's affecting a woman's life. And as we just talked about, a lot of them do have pretty simple solutions.
Thanks so much for helping us understand the bigger picture in diabetes and women's health.
Right. Thanks so much for having me, Rivka.